Laminectomy is the surgical removal of part of a vertebral bone called the lamina. 24 vertebrae make up the vertebral or spinal column. The laminae form the roof of the canal that surrounds and protects the spinal cord and nerve roots. Bony spurs from arthritis, a herniated disc, and less commonly, a tumor, can compress the nerve roots. Depending on the vertebral level affected, this can lead to pain, numbness, or weakness in the neck, back, arms, or legs. By removing all or part of the lamina, a laminectomy allows access to the nerve roots so that the source of the nerve compression can be eliminated. If a herniated disc is present, your doctor will often perform a discectomy, which directly removes the source of the compression. A laminectomy can be done on the vertebrae in the lower back, called lumbar vertebrae, or those in the neck region, called cervical vertebrae. Microlaminectomy and microdiscectomy are procedures performed with the aid of a microscope. When you arrive at the hospital, an intravenous line will be started and a catheter may be placed in your bladder to drain your urine. Most laminectomies are done under general anesthesia, which will put you to sleep for the duration of the operation. A breathing tube will be inserted through your mouth and into your throat to help you breathe during the procedure. A laminectomy generally takes between 1 and 3 hours. For a lumbar laminectomy, you will be positioned on your stomach. Your surgeon will begin by making a small incision overlying your spine and pulling the fat and muscles away from the lamina with retractors. Using a special bone drill, your surgeon will cut away the lamina, exposing the ligamentum flavum. This is a ligament that connects one vertebra to the next in the spinal column. Your surgeon will then remove a portion of this ligament in order to see into the spinal canal and locate the source of the nerve compression. If a herniated disc is causing the compression, he or she may perform a discectomy by removing the protruding part of the disc. To complete the procedure, your surgeon will close the deep tissue and skin incisions in your back with stitches. After your surgery, you will be taken to the recovery room for monitoring. The nursing staff will regularly check vital signs and the strength of the leg on the side of your surgery to be sure the nerve has not been severely injured. You will be encouraged to get up and walk as soon as you feel comfortable. If a catheter was inserted, it will be removed before you leave the hospital. Patients who have uncomplicated discectomies generally leave the hospital the next day. Laminectomies performed for other reasons may require longer hospital stays.